Are you thinking about attending a Restore Scar Therapy course? Well, what do you need to know? The Restore Scar Therapy courses have been really carefully planned and put together to deliver education to try and meet your needs in the best way possible. Information is drip-fed first from the online pre-course learning, so you've got time to digest that in your own time. I keep video lessons really short and compact, add a few multiple choice questions at the end of each lesson so you can just check you've digested the information properly, and then you move on to the next lesson. They're designed to fit around your busy day so that you can grab a cup of tea, sit down, watch a video, answer a few questions, and then get on with your day. By letting that information come to you in little bits and pieces, it gives you a better chance of being able to retain the important information. There's written handouts as well, just to build on that knowledge and support it even further. Then you get to your in-person training days. This is where it's all about the hands-on. You've covered the theory in the pre-course lessons, so that means once you're in class, we can really focus all of your attention on developing your manual skills. And Restore Therapy, I'm 30 years as a manual therapist. This is my background. I work with my hands, and I've got lots of ways that myself and my training team can show you how to use your hands effectively to help improve scars. But it's not limited to your hand use. We like to show you a range of techniques which can work with scars. If you come along to the Scar Therapy Practitioner course, you get the foundation of scar massage skills delivered with your hands. On top of that, you're going to learn how to do silicone cupping for scars, using that negative pressure to lift up the scar tissue, which can really enhance results. Then we can also take a taster session of using K-tape, which can really help with offloading or loading on a scar depending on what you want to achieve. And of course, you may have somebody with facial scarring, so we're going to cover intraoral techniques. What about the Oncology Scar Specialist? Well, with this course, obviously it's really focused in on scars from cancer surgery. And a lot of that is going to be scars within the torso. So everything from breast cancer, lung cancer, kidney cancer, liver cancer, bowel cancer, all of these scars predominantly will be happening in that torso section of the body. So it's really important that you're confident working with these areas. Cording is another really common complication after breast cancer surgery, and something that we're seeing a lot in clinic. So we've got some great techniques to work with cording, and that won't be on the Scar Therapy Practitioner course. Also, it's really important to get breath and diaphragm function working correctly in order to help promote healthy lymphatic flow and to work on all kinds of scars within the torso. So we include how to help work with your client's breath to improve that. We look at different ways of working with the client, from both active techniques where you're getting the client to move while you're working with the scar tissue, to passive movement, and then static where the client is still when you're working with the scar tissue, giving you a really broad set of skills from soft fascial unwinding techniques to really dynamic active stretches. Then you've got the C-section Scar Specialist, just looking at one type of surgery, the abdominal birth. And because it's raising in prevalence around the UK and around the world, it's so key that there are skilled practitioners out there to work after caesarean section. With the C-section Scar Specialist, I really draw on my background as a massage therapist. I'm pulling in techniques of how to work around the ribs, around the hips, inside lying and abdominal massage as well. So again, you're combining a combination of scar massage and abdominal massage to bring strong skills to help benefit your clients. Not sure which one's right for you? Then I would say the practitioner is the place to start. It's the most broad course, but if you already know you're working with a niche population and you want to really specialise in either oncology or to support recovery after an abdominal birth, then you know that those are the courses that are right for you. And you can always do the courses in any order. There isn't a prescribed way to follow through the programme, but any course you attend will be complemented by you coming back and attending another one, building on that knowledge, building on that foundation. And it's fantastic. I'm really enjoying teaching it. We're getting amazing reviews, and I hope to see you on the training.